how the U.S. compares. The United States is one of the richest nations in the world, but it also has the most expensive healthcare of all high-income countries. Given the high price tag, you might think that the U.S. has the most superior healthcare system. So how does the U.S. compare to other wealthy countries? Let's find out by looking at the different kinds of healthcare coverage available, who pays for it, and how health outcomes compare across these countries. In the U.S., many people get health insurance through their jobs. Employers usually pay most of the premium costs, although employees still have to pay a share in many cases. When they visit a doctor or need medicine, patients must frequently also pay extra fees known as co-payments, co-insurance, and deductibles. If you get your health insurance through your job, if you lose your job, you will lose that insurance unless you qualify for short-term COBRA coverage, in which case you'll pay the entire cost of the premium yourself. Government programs such as Medicaid help cover people with low incomes, while Medicare helps those over 65 and those with disabilities or certain health conditions. Some Americans have healthcare coverage through the Veterans Administration or TRICARE, while others purchase their health insurance on the marketplace. However, even with all these different programs, more than 10% of people under 65 don't have any health insurance at all. How does healthcare in the U.S. compare to other high-income countries? Canada. In Canada, the government provides basic health insurance for everyone. It covers most healthcare services for free, including hospital stays. Most people also buy private insurance to help cover things like medications and dental care. In Canada, people live longer and fewer babies and mothers die compared to the U.S. Switzerland. Switzerland's healthcare system is a mix of private and government coverage. Everyone has to have basic health insurance, but they buy it from private companies. The government makes sure that the insurance is affordable and covers all essential services. People in Switzerland also live longer and have better health outcomes than people in the U.S. Norway. In Norway, everyone has health insurance provided by the government. It covers everything from doctor visits to hospital stays and even mental health care. There are some small fees, but they're capped to keep things affordable. Norway also has better health outcomes, with people living longer and fewer babies and mothers dying. Germany. Germany provides health insurance for all its residents through a system funded by taxes. It covers a wide range of services, including dental and vision care. Private insurance is available for those who want extra benefits. Germans live longer and have better health outcomes compared to Americans. England. In England, everyone can get health care without paying individually for each service. The government covers almost all medical costs. Private insurance is an option for those who want faster service or more choices. People in England live longer and have fewer health problems than those in the U.S. Overall, the United States spends 17% of gross domestic product on healthcare. Yet people in other wealthy countries live longer and have fewer health problems. In these other wealthy countries, more babies and mothers survive, and more doctors are available to help. So why does the U.S. struggle with poor health outcomes? One reason is that it doesn't guarantee health insurance for everyone. This means some people can't afford to see a doctor or get the medicine they need. Other countries make sure everyone has basic health coverage, which leads to better health outcomes. Not only does the U.S. spend more per person per year than any other high-income country, Americans have the lowest life expectancy, the greatest burden of disease, and the highest maternal and infant mortality rates. Remember, no healthcare system is perfect. Some countries with universal coverage might have longer wait times for certain treatments. But overall, people in those countries see doctors more often and stay healthier. If you want to learn more about healthcare in different countries, check out the link in the description.